I am Dr. Sheena Sadevan, family physician working at Ovum Clinic, Bhattarahalli. Today, I will be talking about non-communicable diseases. Non-communicable diseases are chronic diseases which do not spread from one person to another. That is, in other words, it is not contagious. A few of them are cardiovascular diseases, diabetes mellitus, chronic respiratory diseases, cancer. Today, I will be talking about one of these, and that is diabetes mellitus. Diabetes mellitus is a chronic non-communicable disease wherein there is increased sugars in the body. In other words, hyperglycemia. So basically, the pancreas secretes a hormone called insulin, which is involved in the metabolism of glucose. So diabetes mellitus can occur either because of an increase in the insulin, a decrease in the insulin, or the body is not able to utilize the insulin which is produced in normal amounts. So it is classified into three major types. Type 1 diabetes, which is usually seen in children, which is because of a lack of insulin. Type 2 diabetes, which is usually seen in adults, and type 3 diabetes or gestational diabetes, which is usually seen in pregnant women. So what are the risk factors for diabetes? There are two risk factors, modifiable and non-modifiable. Modifiable risk factors are unhealthy eating habits, diet, physical exercise, obesity, and the non-modifiable risk factors are age more than 45, ethnicity, and a strong family history. So what are the symptoms of diabetes mellitus? Most common symptoms are frequent urination, increased thirst, increased hunger, lethargy, frequent fungal infections, non-healing of wounds. So when you have these symptoms, what do you do next? You have 2 or 3 symptoms of these. The next is go ahead for a blood test. So the basic blood tests, 3 blood tests are the fasting blood sugars, which is done on an empty stomach, the postprandial blood sugar, which is usually done 2 hours after a meal, and the HbA1c, which gives you an average of the previous 3 months blood sugars. So what is the treatment? Once you know that you are a diabetic, what is the treatment? The treatment is basically medical nutrition therapy, which involves lifestyle changes like exercise and diet, and of course oral medicines and insulin.